All right, everyone. Welcome to another episode of Hi, I'm Doctor. And this week we have a Hi, I'm almost doctor, I guess. Hey, Emily. Yeah.
Almost doctor, yeah.
Almost doctor. We have Emily Ikert. Am I saying that right?
Yes, you are.
Yeah.
Very well done.
Emily Ikert from the University of Saskatchewan, the University of Saskatchewan, my dental school as well, the best dental school in Canada. Sorry, Akil, but I think it's well known that the U of S school is the best in the country as far as I'm concerned, because it's the only one I know of. So welcome to the show, Emily.
Thank you very much for having me, you guys.
Yeah, Emily is, she's in third year, and I'll let you introduce yourself here, but I've been very impressed by Emily. I've been following her on Instagram, and she's motivated me to maybe do some curls for the girls, get my bicep veins back, and hit the gym. So Emily, why don't you introduce yourself and tell us a bit about you?
Awesome. Well, thank you for the introduction already. My name is Emily Ikert, and I am, like Dr. Jamal said, a third-year dental student at the University
She
of
still calls me
Saskatchewan.
Dr. Jamal. Come on, that's adorable.
I was literally, for a second, I was like, who's that? Who's Dr. Jamal?
I'm trying to be professional here, you guys,
No, you haven't met us. We are not professional. No. I don't want to hear that crap.
Okay.
Sorry.
I will refrain from that then.
Thank you.
But alongside being a dental student, I also am a personal trainer and a yoga instructor. So, I work on the side doing that, and it is very fulfilling for me. And it has also helped me to stay positive and stay motivated throughout dental school. And I think that it's really important to balance, both aspects of mental health and physical health, and not let one, scale tip higher than the other. So it's been really helpful for me to be able to have that outlet of the gym, and also working with my clients throughout dental school to keep me on my toes.
How do you have the time for that?
Yeah.
That is a good question. I find myself trying to manage my time very meticulously. So I wake up pretty early in the morning, usually 4 a.m. or 5 a.m. to get things done, but I don't stay up that late. So I think that everybody has to kind of just work with their schedule, how it works for them. Like I always say to people, what I do isn't what everybody is going to be able to do. Like I don't like to stay up late. I go to bed by 9:30 every night. So, it works for me to wake up earlier and go to bed earlier. And then I just feel like getting to the gym and getting that exercise in before I come to school, before I start clinic, I just get that rush of endorphins and serotonin, and I'm able to take time for myself before I have to give so much time to other people and my patients, for example. And it allows me just to have some space, which I really need and really enjoy. And I do think it makes a very positive impact in my day.
Emily, I just got to ask you. So I watch all these reels on Instagram that make me feel like shit, because they're all like, man, if you're not up by 4 a.m. or 5 a.m., you're losing half the day. All the most successful people are up by 5 a.m. But man, I'll wake up at 6:30 and then I look at my phone and I'm like, oh man, I'm going to sleep for another half an hour. I don't understand how this will lead to my success by waking up early. How do you motivate yourself to get out of bed, and why do you wake up so early?
I truly enjoy it. I think that is where it stems from. I do truly enjoy waking up early and being able to have this time for myself before everybody else kind of comes into the picture, if that makes sense.
Yeah.
And I wouldn't say it's motivation as much as just discipline and habit and routine. I've just done this for so long now that it's a part of my everyday. And if I don't wake up early, I feel weird. You know what I mean? It's oh, I'm missing something. So it's all about just creating those habits, I find, and really finding what works for you and what sticks for you. A lot of people have the habit of staying up later and they get their stuff done and they're night owls. And I think that's completely fine. I cannot do that. So my habit is to wake up early and just, I'm pretty regimented with my routine. So I think that's why everything sticks. But yeah.
You got that discipline, man.
No, well, listen, I was an early bird until I got a specific co-host that is in a different time zone than me. So I can no longer record episodes until 8 p.m. So now I have to record episodes till 9:30, 10, 11 p.m. So I'm up at a late hour of 6 a.m. now. I used to be a bit better. But Emily, I gotta ask. So I also go to the gym in the morning. Subtle flex. I'm going to be a billionaire one day because I go to the gym in the morning.
That's right.
No,
Can I borrow $20?
Yeah, exactly. So I go to the gym in the morning, and this is a dentistry specific question. I find when I go to the gym really early and I have a patient, first thing in the morning, my hands are a little shaky because you're kind of tired. You're kind of like your muscles are just exhausted, right? Because I'm pumping massive 20s for like for 35 minutes in the morning. So how do you get around that sort of like muscle fatigue? It's a very niche question. I don't know if you experience it, but how do you get around that?
So I try also to limit my caffeine. So I don't take pre-workout or anything like that, because I find that having too much caffeine right away in the morning, especially, is just gonna, especially if you haven't eaten food and you're going to the gym and you haven't eaten that much, it's obviously going to cause you to get a little shaky and maybe a little bit dizzy, just feel a little bit nauseous. So I try to limit caffeine. And then I always I eat a pretty big meal after the gym. So I make sure I have a lot of like complex carbohydrates like oatmeal, berries. I have protein and fats in there just to make sure that I'm like nourishing myself, because I do notice like if I don't eat enough food, I will start to feel, a little bit fatigued, a little bit dizzy, a little bit nauseous. So that's one of the most important things to me, is making sure I'm having like a very balanced, healthy meal afterwards, and then drinking a lot of water too. So I always try to drink 1 or 2 liters during my workout to make sure I'm staying hydrated also.
Noted.
Emily, like I have a lot of respect, because I find the hardest part of working out is meal prep. And I can't say that, I'm a stud in the gym or anything like that, but I see you on Instagram and you're like spending hours in the gym every day. Like it's so incredible to see that. But like, I know you gotta get a lot of calories in. And when I was in dental school, I was eating more Uncle Ben's rice because it was just so fast and easy to make. I couldn't imagine like having to actually do like meal plans. Like, how do you get around that, or what are you doing?
I I don't like to cook that much. Like, full disclosure, I do not like to cook very much. So I do whatever's fastest and easiest. So like I said, like I'll do overnight oats, and that takes like 5 minutes to make at night before, the night before the morning. And then for lunch, like I literally eat like frozen vegetables, and I'll cook up some protein in the air fryer and just use that for the next couple of days. So like frozen vegetables, throw in your chicken. It takes 5 minutes to put together. Like, I don't cook, but just like finding those options that are quick and easy, but still healthy and nourishing. I think that's my go-to typically.
That's
Uncle Ben's rice is up there.
It's so easy. It's so good, man.
That's definitely the hardest part of, I find, like maintaining a healthy lifestyle is you can put in the hour to go to the gym, like most people can, but actually being consistent with the diet is by far the hardest part. Like by far, far is the hardest part. So
I definitely agree.
If you can have those little hacks and those little tricks, of meal prepping, which I'm a procrastinator at heart. So meal prepping is definitely out of the books for me, but it's helpful. It's really, really helpful.
Yeah. And it saves a lot of time. Like, I find even right now, like I'm at school right now, I've been studying majority of the day, and like I just make sure I have my meals prepped the night before, and then I can go to school. I don't have to waste any time cooking or anything like that. And I can just, it's all about that time management. Like I said, trying to maximize the time as best as you can. So I try to have things prepared in advance, so I don't have to spend extra time thinking about it or doing it during the day. And I can really just optimize my time to either be studying or be in the clinic with my patients or be working with my clients on their personal training and all those kinds of things.
So Emily, like we're kind of dancing around the subject here. Like, can you tell me about your fitness journey?
Yeah, I definitely can. It is a little bit of a longer story. I was quite overweight and obese as a child, up until about grade 8. And that's when I really started taking care of my health. So I never was anybody who was into sports. I was definitely not a healthy eater. In grade 8, I weighed about 230 pounds, around there. So since then, like I've lost quite a significant amount of weight, but it all started I honestly just started working out in my basement, doing body weight workouts, following stuff on YouTube, and just hiding it from everybody because I was embarrassed about it and I didn't want to talk about it. So I just kept my door closed and stayed in my bedroom downstairs. But eventually it progressed and I started to see the progress. And when you see the progress, you start to build confidence, and that helped me to, open up and be open about it with my mom and with my family and then with my friends. And then I felt confident enough to go get a gym membership, and it just, kind of escalated from there. And I definitely fell in love with lifting weights more so than anything else, and just the feeling of empowerment that it gave me and the confidence that it gave me. And it really stuck with me, and I wanted to help other people feel that way because I knew what it felt like to feel so self-conscious and lack so much confidence in myself. And once I was able to acquire that, I just wanted everybody else to be able to feel that as well and be able to experience what that was like. So I'm a big proponent for, finding whatever makes you feel the happiest, whatever makes you feel the most confident, and then continuing to work on that. Not everybody needs to be in the gym lifting weights. Not everybody needs to be running or, doing any, super extreme sport. You can do something that's casual, like walking, and that's completely enough if that's what you like and that's what you enjoy.
Emily, I think that story is so great. And I think Neki and I have had this conversation before, but obviously you and I have never met. I don't know if you and Neki have ever met in person, but so Neki and I were both heavy kids growing up. So I have a similar sort of arc. I was, well over 200 pounds in first university, ended up dropping about 50 pounds going into my second year and third year. But, I've got to tell you, the easy part I almost found was losing the weight. The harder part was losing the fat kid mentality.
Yeah.
So
I agree.
how have you sort of navigated that journey?
That's a tough question because I don't know if I'm necessarily there all of the time. I think that anybody who has gone through any kind of struggle, no matter what it is, if it is, being in poverty, if it is being overweight, if it's dealing with a medical issue, you kind of attach your identity to that a little bit. And it's really hard to release that identity. And, even when I meet people for the first time now, I still assume that they're going to see me as the 235-pound person that I used to be and not who I am now. So it's really just trying to slowly strip that identity off of myself and attach new pieces of myself to who I actually am and how I want people to view me, which it takes time. Like I've been working out for 10 years and I'm still struggling with that. And it gets easier over time, but I don't know if it ever necessarily 100% goes away. And I think that what we have to do is just be able to acknowledge that and say, hey, these thoughts are in my head. I'm realizing that I am, being self-critical, and I am, having a lower self-esteem, but they're not true thoughts, they're false thoughts. And I just need to reframe my mindset and try to, change my perspective a little bit. And slowly it becomes easier to change your perspective and see those positives about yourself, before you see the negatives, for example. So it really is a process, I would say, for sure.
I find this topic so difficult to talk about because, and I'll get vulnerable here. Akil and I spoke about this. I still remember visiting my grandma in Toronto, and I was 13 years old, and we had like this family picnic in the park, and I just went walking around, and I walked by these two girls, and I could hear them talking about me because I was like, they were right behind me, and they said, "He's fat and he's ugly." And these words have stuck with me for the last 26 years. And it's still in the back of my mind. And I will always be that fat, ugly kid because you can't just strip it off you. And, Akil's had similar stories, and it's weird. Like as we grow as people, we can achieve anything in the world, but these words are always in our head. And like, what do you do? Like, what would you tell someone now? Like look at you, like you're such a fitness and motivational, like you've achieved so much, but like, I know we all still hear this in our head. What do you tell yourself, or what would you tell someone to get over that?
I try to remind myself that other people's opinions of me should not dictate my own opinion of myself. So I always remind myself, we all live in our own universe. We all have a world inside of our head that is completely separate and different from what anybody else lives in and what anybody else thinks. So why am I letting what someone else is, choosing to bring into their world affect what I'm bringing into my own world? And, it's a daily reminder, 100%. Like, somebody might have a negative opinion of me. I just had this experience on the weekend where somebody, told me, I don't like this thing about you. And I felt my heart drop into my stomach for about 20 seconds. And I was like, ooh, I'm kind of self-conscious about that now. Maybe I should change this thing about myself. And then I had, just like that little conversation in my head. And I was like, why am I letting what they think about me change how I think about myself when I was previously confident about this aspect? I shouldn't let that opinion change how I feel, because it's their choice, it's their opinion. It doesn't have to be my choice and my opinion. So then I said, nope, I'm actually not going to attach that to myself. And I'm going to continue on, choosing my own belief system about my world and my narrative. So it's just a work in progress. I don't know if that was a good answer to the question, but
great
answer. I try to just try to remind myself, like, other people's opinions of you do not dictate the opinion of yourself. And also, if somebody's showing you judgment towards you, that's just a reflection of their own self-criticism and own self-judgment. It's, projection. It has nothing to do with you at all.
For sure. I caught did either of you catch the Chris Rock Netflix special yesterday?
No, I didn't.
No. Okay. So it was like the first time he publicly talked about getting slapped by Will Smith.
Oh, yeah.
Yeah. So they did it live on Netflix. But anyways, he has a great line where he goes, I've been in this industry for a long time. And you know why I know bullies should exist? Because I've never been handed a check from someone who's taller than me. But I mean, speaking from like, any perspective, any come up story, any position where you're an underdog and now you're not, right? How do you handle when people treat you differently because of the way you look now versus then? How do you handle it? Because there's two ways to go about it. You can have an ego and you can say, I don't want to put words in your mouth, but you can say X, or you can, go down another path. How do you manage that sort of relationship?
I feel like I don't know if I've actually had those interactions that much. People might come up to me and say something about how I look or what I do in the gym, but a lot of the times I find myself deflecting it, actually, which I need to work on, and I need to actually just receive a compliment if it's there. But I definitely find myself deflecting quite a bit. So I don't know if I'm necessarily at that point yet where I'm accepting, that people are seeing me differently, if that makes sense.
I tell Akil the same thing. And I think it's just all a part of our past, because I will compliment him and I'll be like, dude, I'm really proud of you. I think you're really doing well. And he'll be like, what about all the other people? They're doing better than I can. And Emily, you're doing the exact same shit right now too. Like you're deflecting, you don't want to accept the compliment. And I think this is a huge character fault of a lot of people, is when someone gives you a compliment, it would be like, think about the power of just being able to say thank you. Like, think about what that would do to our own self-esteem. But yet so many of us just push it off and not thinking that we're worthy enough to get that respect from another person. And I just want people to be able to accept that thank you. And I lecture Akil all the time. I'm like, dude, just say you're welcome.
This was last night that he lectured
me.
This was literally last night after a podcast. Yeah, it happens, right? Because you don't want to, I don't know if it's, and I know someone who just lectures dentistry, her name is Jessica Metcalf, and she talks a lot about imposter syndrome and how that bleeds into a lot of people's reality. And when it comes to accepting praise, my gosh, like accepting praise is the hardest thing you can do.
It is. Yeah.
Like it is so difficult just to say, hey, thanks so much. Like I can't tell you the number of times where like I'm going into a movie and the person at the ticket booth's like, enjoy the movie. I'm like, you too. Because I don't know how to accept just like good wishes or like goodness, right? Because you just want to deflect back. You're like, no, I don't want to accept that because that's too vulnerable for me, right? What if you like just pull the carpet from under me and you're like, haha, I was just kidding. Right. Yeah. So it's a really tough thing to do.
Yeah, I think a lot of it is almost a protection mechanism too. We don't, like you said, want to get too vulnerable just in case they decide to retract what they said, or just in case we sound too egotistical when we say thank you. Like we're always just trying to stay humble and we don't want to make ourselves bigger than we actually are, which I think is something that we should work on, is allowing ourselves to take up that space and allowing ourselves to, like I said, just receive those compliments and receive anything great that comes our way and know that obviously it's coming our way for a reason. It was meant for us. And if we deflect it, then we're not going to get any of that anymore because it's not going to come to us anymore. We have to allow ourselves to accept in order to keep on getting that abundance coming into our life. So it's tough, but I think just trying to shift that perspective from like abundance, or from lack to abundance rather, because the more that you deflect, the more you're not going to gain
Growth
anything
mindset, man.
else.
Growth mindset.
Yeah.
For sure. I mean, I look at other issues, right? And Neki could probably sympathize with this. Like if someone comes into your chair, man, and you're like, and they come to you and they say, my third molar is killing me, right? You'd probably, what would you say?
I'd say, no problem, man. I got you. That's why I'm here.
Yeah. Or you would accept the fact that they're in pain. But it's funny that the societal placement, or like, I bet you some people that are listening to this podcast are like, wow, you guys are complaining about being too fat. There's people in Africa who can't even eat.
Yeah.
Right. So it's like the judgment that's placed on an issue of weight, I find always, it just bothers me. I don't know if either of you have experienced that, but I find it's a really tough thing to navigate.
Hmm. Well, and I think another thing, especially coming from like my personal training background and working with a lot of other people, I've had hundreds of clients over the years, and I never want to say something negative about my old body because I know that that is the body that a lot of people are living in right now. So I never want to shame it. I never want to say that it was not good enough. It's just different from how I am right now. And it's really tough to make sure that I'm wording things correctly because, of course, I'm proud of the progress that I've made, but it doesn't mean that who I was before was a worse person than who I am now.
I totally hear you. And I think it's a fine line speaking
Mhm.
about things, and I'm glad you're speaking about it. You're much more eloquent than I am, and I like to put my foot in my mouth a lot. So I'm glad you're saying these things. But Emily, I'm interested in your mindset,
Mhm.
because like I'm envious of your ability to work hard. And I feel like I can work hard in some things, but then I see you all the time and I'm like, man, this girl has dedication. Talk to me
Well, I
about how you
appreciate
push
that.
yourself. No, I'm dead serious. This is me complimenting you. Please accept the compliment.
Thank you. I
Yeah.
accept it. I do.
Yeah. How do you push yourself?
Um, this is going to sound like maybe a little bit controversial, but for me, it comes down to the point of I know that it's possible for me to do more. I know that it's possible for me to exceed in these areas. And I would regret not pushing myself and not accomplishing the things that I've always wanted to accomplish. So if I know that I'm not giving my 100% effort in every area, then the only person who's to blame, if you want to say blame, for me not succeeding would be myself. So I always want to make sure that I am giving my absolute best everywhere that I can because I want to see myself I want to see myself succeed, and I know that I have the potential to do that, and I don't want to be the limiting factor in my own growth and my own potential. So it's just, I want to make sure that I get to where I want to go and I don't get in my own way with it.
For sure. I think it's interesting, right? Because dental school, and I think dentistry in general, is not a very efficient machine in that the effort you put in doesn't
Mhm.
equate to the same output on the way out, right? It's not like when you work out, right? Again, know nothing about working out, to be clear, right? But it's not like when you work out, there's like a certain amount of effort and you expect a certain amount of output. But there's just so much in between your effort and output in dentistry and school that sometimes you can't really, the two don't really equate. How do you manage when those two don't line up, where you're just putting so much effort in, but you're only getting like 50% of the output back?
Yeah, that is definitely tough. Like for example, if you study, 30 hours for an exam and you still don't get the mark that you wanted to get. And I think that that is something that has bothered me in the past. And I think, well, why did I even put this effort in? Like, I'm not getting what I want out of it. But at the same time, I just say to myself, okay, but if I put in less effort and I know that I didn't give my 100%, then I would have been even more disappointed with this mark, because I know that there's a possibility that I could have done better. But if I actually gave every single, ounce that I had, then this is what was meant to happen. And this is just, the outcome, and I have to be okay with it. And there's no better outcome that could have possibly happened from the situation.
Emily, I appreciate what you're saying, but how do you become like a trainer during school? Like, do you
Okay.
feel like you can like give all of you to your clients when you have all this going on at the same time?
I
Like, how do you
definitely
manage that?
I definitely feel as though I've been able to keep up my relationships with my clients quite well. So I started personal training before I got into dentistry. I
Oh,
was
okay,
in,
okay.
yeah, it was in 2018. So I was still in undergrad, first year university when I started personal training. And a lot of my clients now, I would say about 40% of them have been with me for over 3 years. So we've developed a really good relationship. And I just have, I've been doing it for almost 5 years now. I feel like I have like a flow, how you talk about your
Yeah.
workflow and all of that. And I don't have to put in as much time as I used to, because things flow a lot better. So I'm able to just be efficient with the energy that I give and still show up how I need to for my clients. And I typically dedicate every Sunday to client work, and I'm doing my check-ins with my clients. And then I do have like an hour in the morning and an hour at night where I'm checking the app that we use for communication. And I try not to go on it during school time. I try to just separate my time of the day. So, this is my time for my clients. This is my time for school and my patients. This is my time for myself. And I try to keep them a little bit separate so that I'm able to give energy where I need to and not feel like I'm going 100 different directions all of the time and just burning myself out.
Do you think that being a trainer and being a yoga instructor makes you a better dental student and dentist, and vice versa? Do you think being a dentist makes you a better trainer and yoga instructor?
I don't think so. Like, I would not say that I have a leg up on anybody else. I would say that it definitely benefits me in terms of learning how to communicate with people, because being a personal trainer, there's a lot of tough conversations that you have to have and a lot of empathy that you have to have towards people. And I definitely noticed that that carried over into patient care once I started seeing patients as well. But I don't think that how I handle things is any better than how my classmates or my peers handle things. It's just, it allowed me to have a different experience for myself, and it allowed me to, bring different aspects from different areas of my life, if that makes sense.
Emily, I see this like similarity. There's a client coach, like what do you call yourself? Like a workout,
I
a
call myself
coach,
a
right?
coach. Yeah.
A coach, yeah. So there's the client coach relationship, and then there's the dentist patient relationship.
Hmm.
I find that they are actually, in my head anyway, that they would actually be quite similar. I find
Hmm.
as a dentist now, I've been dentist for 14 years. I find my job is motivating people all the time. I'm like, don't worry, I'm going to help you get through this. You can do great. You're going to do awesome. I got you. My hand's always on your back, like, pushing you along the way. And yet you've been doing this already. I'm so curious to see how you're going to interact with patients after you graduate. Like, have you noticed some similarities there?
Oh, 100%. 100%. I definitely find that I pull a lot of skills from both coaching and from yoga actually into the clinic chair.
Well, I'm so
Um,
curious. Like what? Like what?
so, especially with giving anesthesia, for example, patients tend to be quite stressed out and a lot of them don't like needles. I understand that. So, I kind of try to implement yogic breathing techniques for them, and I help them breathe to get them into a more parasympathetic state and a stress relieving state. And I find that it's helped a lot. I just try to the way that I word things, I guess, I try to word them in a way that is more motivating as opposed to condescending and more, uplifting. It's just something that I've really had to learn as a coach is like, it's not you and me, it's we together. So I try to also use like we and us statements as well when I'm working with my patients, because I don't want them to feel like it's me against them. I want them to feel like it's us as a team working together to help them create the best outcome that they want for their oral health. So yeah, I find that it is, there's a lot of parallels between the two for sure.
And let me tell you, giving a lower block never changes. Like, like 14 years out, it only gets worse because you start to cringe and you're like, am I going to hit the lingual nerve on the way in? And the patient's going to jump. And I don't know if you've done that or not already, but it only gets worse. And then you see people jump and they're like, I felt it down my tongue. And then every single time that happens, I feel just a little bit shorter. Like I feel a little bit smaller. My confidence goes down. I'm like, damn it. Even though I can't see the nerve, I'm still hitting it. And it just, that's the worst part of dentistry for me. Akil, have you done that yet?
I have not. No.
Guess what? It's kind of, Emily,
I
have
know
you?
it's coming.
Yeah, I have.
Yeah. Oh, that's the worst. And it's like, what was that zing? What was that shock? I think local anesthetic is the worst part of dentistry. So I think it's great that you're helping with breathing techniques and all that stuff. Can you like tell us like what are you teaching them?
Yeah, so I tell them to breathe in through their nose and out through their nose as well. And it's really hard to breathe in and out through your nose when your mouth is open a lot of the time. So it makes them focus harder on that because you want to automatically breathe out through your mouth. And then doing 3 seconds in and 3 seconds out is really beneficial to help bring you into a parasympathetic state. So it slows your heart rate down, it calms your anxiety. And that is, I don't know, I find that it's been beneficial so far. So hopefully it works for the patients. I think it's working. I don't know.
Yeah, it's calming you down more than anything.
Yeah.
But Emily,
It's
what's your, like, I mean, let's do some trauma bonding here. What's your, biggest stress in dental school? Is it getting your credits? Is it passing classes? Is it managing patients? What's your biggest stress?
honestly managing patients. I just feel like I never want to have a negative patient experience, and that's inevitable. We know that there's going to be negative patient experiences, but it sucks when you feel like you've let a patient down, or you feel like a patient is upset with you or mad at you or whatever the situation is. It's, a little bit of a people pleasing on my behalf, which is, not the best trait to have. But I think that in the end, like, your patients are what matters the most. Of course, we're all going to graduate and we're all going to get there, regardless of what our grades are, regardless of if we pass a class or an exam. But I think it is the impact that you leave on your patients. Like, they're going to remember that. And you have to realize, like, that's a life that you're dealing with and somebody's emotions. And that's way more important than a grade on an exam.
Emily, I think you've unpacked something here. And I can tell you local anesthetic sucks. And the hardest part about being a dentist is managing patient expectations. And I was telling Akil this, like, I don't care how far along you are on your career. Like when we were talking to Bruce Freeman, he's a very experienced clinician, deals with chronic pain patients all day. And his number one goal in life is to manage patient expectations, because that's what's going to define your career and the success you get out of your career at the end of the day. But you brought up a really important point. Being someone, and the three of us are all in the same boat. We're all battling our past traumas. And I think everyone battles their past traumas, but I think those past traumas make you into a people pleaser. And I'm still a people pleaser to this day. And I call all my patients on Sunday, every Sunday, from the week, and I'll spend 3 hours doing it, talking to all of them just so I can hear, Neki, you did a good job. Do you know what I mean? And
I know.
and I think this is a huge, I don't even know the words I'm looking for. It's all coming to me right now. This is just a huge chunk out of my armor, because I always feel like I need to please those around me. Like, how do you get over that? Or are you in that stage right now? Or what do we do?
I definitely feel like I'm still in that stage. It's kind of that external validation, right? Because
totally,
if you went through that childhood trauma of not ever feeling like you were enough, or not feeling like you were being praised, or just not ever having validation, nobody told you good job, nobody told you I'm proud of you, you're always kind of searching for that and searching for that and searching for that. So I definitely understand where you're coming from. And I think something that I try to do is like making sure that I tell myself I'm proud of myself too. Like I don't need other people. Obviously, we all like other people to tell us that we're proud of ourselves. And it is tough not having somebody to externally validate you, but internal validation is what we're really searching for. So
Oh,
we need to
totally.
be proud of ourselves first and foremost. So at the end of the day, every single day, I write down 3 things that I'm grateful for and 1 thing that I'm proud of myself for. And I've done this for years. And I think that it has really helped me shift my mindset and helped me to uncover, some things. And like, even if I had come home and I had like a bad day, or I had maybe a negative patient experience or a negative exam experience, whatever, it's like, okay, what 3 things can I be grateful for today? Well,
Gratitude.
I might have had a really bad filling and hit the pulp, but I learned. I had a learning experience, so I'm grateful for a learning experience, and I'm not going to do what I did again, or something like that. And it's like I'm proud of myself for keeping my calm with my patient, even though the situation wasn't ideal. Just like little things like that, and just making sure that you are. I always tell myself, like, we're always searching for what our inner child never got. We're always searching for what, was never given to
Yes.
us as a child.
So right. Yeah.
So, but then we
Totally.
also have to remind ourselves that the inner child still lives inside of us. So we are able to give them what they needed by giving that to ourselves and heal that relationship. So I think that's kind
100%.
of where it comes from.
That's a great analysis. That's really good analysis. You know what's interesting is it just occurred to me that all 3 of us do this coping mechanism that I figured out that I do, because I find when I meet a lot of people that are doing many things at once, like Emily, you have a million things going on. Neki, you got more things than I can even imagine going on. I find spreading your eggs in multiple baskets is a very common coping mechanism, but it can also be very destructive because it doesn't allow you to go deep. Because the
Mm-hmm.
minute you go, because spreading your eggs in multiple baskets is just another way to say, okay, well, you can shoot me down here and here, but I still have a leg here. But it's sort of interesting that all 3 of us have that same common trait. That it just, while you were talking, I'm like, wow, like that's such a commonality between all 3 of us.
Damn, homie, that was deep. I like
Yeah, that
that.
was deep. Got me realizing some things about myself here.
But there's some truth to it, right? Like I learned that about myself probably about a year ago, and since then I've realized that it's a really good thing, because a lot of people have a really tough time starting and a tough time doing things that are outside of their like one domain of expertise, because it takes a lot of courage and energy to go do things you're not inherently good at. Like none of us here are podcasters, right? Like we just bought mics and started calling people on Zoom, right? So I barely even had a mic before Neki. So it's like, but the issue with that, right, is you can't have 1 foot in, 1 foot out. You got to have 2 feet in everything you do. So that's the thing that I've learned about myself, is you can't do it and kind of be in and out. You have to really dig deep into everything and try to get really good at it.
Yeah, I agree.
Hey, Emily, I got a question for you.
Mm-hmm.
I started seeing a counselor, therapist, whatever you want to call her, a couple years ago. Completely changed my life, because it's like what she did was so powerful to me, and she made me believe that I shouldn't care about what other people think, and we all have our own reasons to seek external help. Have you ever considered doing that, or do you currently see someone to talk stuff out with?
100%. I made it a New Year's resolution for myself actually this past 2023 to go to therapy, because I knew that there was stuff that I was, harboring in and wasn't letting come to the surface that was still affecting me. And I've only had a couple of sessions so far with them. And it's already been absolutely life changing, like completely polarizing in the best way possible. So I
Yeah.
do recommend it for anybody. Like, I don't think that you have to have significant trauma or be feeling sad or, any negative emotion to go seek therapy. I think that it can truly benefit anybody, because it just shows you and teaches you how to handle negative situations or negative emotions, which every single person deals with.
Does it help you as a student?
Yes, very much so. I do think that it teaches me how to take pressure off of myself in certain situations, and also teaches me that I don't have to necessarily appease to the authorities all of the time, if that makes sense.
I think you and Nikhil got more in common than you knew about.
I knew the tattoo was indicative of something.
Yeah.
But
Because there's
seriously,
some
what's
street credit over here.
what? No, but like, how is that in at your school? Like, are patients like sweet, or instructors like that's awesome, or are people like cover that up?
Oh, the tattoo? No,
Yeah,
everybody loves it actually.
yeah,
It's very interesting. Like I had one of my patients last week was at 88 and they were just like, "Can I see it? It's so beautiful. I love it." And I'm like, "Wow, I've never had a negative comment towards it, only positive." So people
yeah.
might be negative and they just keep it to themselves, which is okay, but instructors have all been very kind about it and positive about it as well. So that's good. Have you had negative interactions?
Well, no, it's funny because so I had a bunch of tattoos like above the elbow, for a
Mhm.
while, and then I finally got one below the elbow, probably what was it, like a month ago, maybe a month and a half ago. And then immediately I'm like, it just changed because no one ever saw, like, my scrubs covered up to the elbow. So no one ever saw it. But then as soon as I got this one, probably on a daily basis, people are like, that's awesome. Like, tell me about it. And it's such a difference from what I thought it would be because
Mhm.
obviously, getting a tattoo and like any professional career where it's visible as mine, um, it's like you would think it would be looked upon, negatively, but I've also only had really, really good experiences from it. So highly recommend, Neki. Highly, highly recommend.
Yeah.
Man, I'm too scared to do it. My business partner, Eric, when he started working with us, like I think 6 or 7 years ago, he had this like sleeve, like tattoo up here. And we're like, okay, I don't care if you get tattoos. I just don't want neck tattoos. But then it slowly started working down his arm. And we're like, dude, you can't get a full sleeve tattoo. You're working on 80-year-olds. And now he just rocks it like a full-on sleeve tattoo. And everyone just loves it. And it helps him connect with so many people. And it almost like removes this barrier, this like dentist patient barrier. And it just humanizes people. And they're like, yeah, no,
Mhm.
I go hunting, I do this, like I got full sleeve tattoo, and so do you. And so I if I wasn't too scared on putting something permanent on my body that I wouldn't regret in like 2 years, I would totally do it. Cause then I'm like, I was talking to my girlfriend, Nicole, and I was like, man, Nicole, I think I know what tattoo I want to get. And she's like, well, what are you going to get? And I'm like, I'm going to get like an elevator, like right here. I'm going to get like an elevator. And she's just like, you're just such a dork. You know that, like, you can't get a dental tattoo. And I'm like, but I just love it so much. Like, that's me. Why are you trying to cover up who I am?
I say do it.
I'm right. But she's like, maybe you can pick a more manly spot, like, questioning my masculinity. And then when we were at that dental student conference, I was sitting there and the girl beside me had a tooth tattoo, like right on her palm there. And I was like, okay, maybe I could man up a little bit and get it up here somewhere. I don't know.
That's so funny. So the guy that did my tattoo, he's from Vancouver. His name is Janky Doodles. Awesome guy. Check him out. But look at this look at the tattoos he does.
Was it
It
meaningful?
says meaningful tattoo. He just does, like, it looks like his type of like tattoo style. It's like it looks like a 3-year-old drew it,
Oh my goodness.
but it is so he's such a good guy, and some of his stuff is so creative. So I mean, my tattoo is not like that. It's like pretty normal. It's not his normal style, but I just laugh at some tattoos. And he's like, even when he was tattooing my arm, we were just talking because it took like an hour to do, or like an hour and a half to do, and he's like, I don't get when people are so up in arms about other people's tattoos, because it's not on your body, it's on the other person's body, so why does it bother you so much?
Totally, man. Hey, Emily, with if they don't care about your tattoos, like, are there any, like, and we're talking about your dental school profs, are there any dental school experiences that haven't been so great for you that you wish you could change?
Honestly, no, I think that I've had really good experiences so far. Like, obviously, not everything has been smooth runnings, but like I said, I've learned from every single thing that's happened. I've had maybe a couple unfortunate situations within clinic and things that didn't go well the way I wanted them to, but
Like what? Like
it's that
what? Fill us in here.
just like over tapering a crown prep, you know what I mean, and not having it be absolutely beautiful the way that you want it to be, and having a 2
How many
millimeter
times
margin
in
instead of
dental
1.
school you end up with like the TP prep? You know what I mean? Like the
Yeah,
actual like, and you're like, oh, that didn't go so well.
exactly. And then it's just like, okay, well, the prof literally said, well, you learn from that and you're never going to do that again. And I'm like, you're right, I never will do that again because it didn't feel good and I didn't like it.
Yeah.
So I think it's just stuff like that, like you just have to kind of let it brush off of you. I mean, honestly, I think that we have a really tight knit college. I really enjoy the dental school experience.
See,
And
Akil, I'm telling you, man, U of S, it's totally different. It's just, it is so much more of a tight knit experience. Like, how many people are in your class, Emily?
there was initially 32 and now there's 37 with the international students.
Really? Okay. Yeah. See, we didn't have international students when we were going through. We had 27 in our class.
Oh,
And
wow. Yeah.
yeah, you really get to know everyone. And I can't say I talk to everyone still today, but you still have your best friends that you talk to all the time, and you send x-rays back and forth and laugh at each other and at each other's mistakes. But it's funny, like when you first graduate, when you get together with your friends, all you do is talk dentistry. And it's just like the common new grad thing. I did this, I did that. And like, you can get together with 5 newly graduated dentists. You talk dentistry for 6 hours. And then 5 years later, you meet up with those same 5 people and you do not say a word about dentistry. It's just like, then you actually become, more than dentistry colleagues. It's like you have your core group of friends that have been through everything you've been through, and come out on the other side, and you're just bonded by it. So I don't know. I really like my dentistry friends. Now that we don't talk about dentistry, it's just so much better. But I don't know. Do you have like tight knit friends in your class, or?
Oh yeah, we have a really, really good class. And I would say like I have a good relationship with every single person in my class, I would say. And then I have a pretty large core friend group. There's 10 of us that we do majority of things together, and we are go on trips together. Like we already, I don't know. I'm very, very, very grateful for the friend group that I have. And I definitely can see us remaining friends post graduation, and we do a lot of things that are non-dentistry related already, which is really amazing, and I'm very happy about that.
Can you tell me what your clinical life looks like? Because I think one thing that I noticed from going to the were you at the dental student conference in Montreal?
Yes, I was. Yeah.
Okay, I guess we just must not have run into each other, but one thing I noticed is there's such a discrepancy between the dental schools in terms of like the clinical work. Like I think I was talking to someone who was at Sask, and they were like, we graduated with 300 surfaces or something. So how many surfaces are you doing? What are your requirements? Take us through that.
So the requirements to graduate are, let me think about this. You need 8 canals of endo, 8 fixed credits. So that could be like a bridge is 3 credits and then each crown is 1 credit. You need, I think, at least 100 operative credits. I'm not totally sure on that one. What am I missing? You need 1 tooth-borne RPD, 1 tissue-borne RPD, and then at least 1 complete set of dentures. What am I missing? We've got removal, we've got fixed endo. You have to watch and assist in at least 1 perio surgery, and then just do good in your like perio SRP. I don't think there's a minimum amount of credits required for that.
I totally failed that.
What?
Man, I suck at scaling and oh my God. I ended up, the hygienist came back and she was like, I was always nice to her. We always joked around, and she finally passed me, but she was like, promise me you're never going to do this when you graduate. And I said, don't you worry. I will never do that. But like the numbers totally went down. When I graduated, it was like 19 canals, and I think we needed like 18 fixed credits. So it's totally changed.
Yeah.
What's going on, U of S? I'm not donating another dime until you guys bring back up the credits.
There's like no endo. It's so hard to get endo, I think is the issue. Like we have I have patients that need endo, but there's fourth years that don't have enough credits to graduate. So like I'm
Yeah.
giving my endo away, which is, I mean, obviously we want them to graduate, so that's good. But yeah, there's just not as many people coming in that need root canals anymore. Everybody's just getting extractions.
All this oral hygiene stuff is kind of working, I guess. Hey?
I guess so.
So when do you guys start actually drilling teeth? Because for us at U of T, we don't actually start drilling until third year.
Yeah, third year, like first week of classes. In
You're
third
already
year, we're
No,
working,
but they're
yeah.
doing sim lab in first year. Are you guys doing sim lab in first year, Akil?
Yeah, we're doing sim
Yeah.
lab, but it's not until third year where we actually start to see patients.
Oh yeah.
Yeah.
Like for restos.
Yeah, that's when we start as well. So we start perio patients second semester of second year, and then we start with everything else in the first semester of third year.
I still remember during the because you have to like watch and assist, like you were saying, Emily, a perio surgery, but
Yeah.
there weren't that many perio surgeries, and I had like 1 millimeter recession on the lingual of my 4-1, and so I was the perio surgery example, I guess. And there's a whole bunch of people watching it all, and then the next day, I wasn't even thinking about it, and I had all these stitches down there, and I just bit into an apple. And it just pushed all, and it was just bleeding everywhere, and I was just yelling at the top of my lungs. And it just goes to show that dentists are always the worst patients. So that's I think yeah.
Did Dr. Otero do that for you?
Yeah, he's still teaching there? Yeah.
Oh yeah.
Oh man, that guy he's just
he's amazing.
He's amazing. Him and Dr. Uzwak are actually the two people that inspired me to start doing dental brigade work. Dr. Otero's from Mexico, and he used to tell me about stories about how he'd go around to the different villages in Mexico. And then Dr. Uzwak, he used to be the dean, the only smoking dean in the history of dentistry in Canada, and I love him for it. Can you imagine, Akil? You go outside for lunch and your dean's just out there just puffing on one. And
more like you're in the middle of an appointment and you're like, Dr. Uzwak, you're supervising me, where are you? And then you look out the window,
just having a smoke.
There you are.
Just love him. Just absolutely love him. But he used to tell me stories of him like going to Bolivia down the Amazon with all these like drug people, and he was like out there doing dental work, and you know, that was the cool part about going to a small college is you get to like hang out with these people and you get to learn about them, and these were my mentors as I'm going through school and then graduating. And Emily, I saw you at U of S, and that was my first time in that dental clinic in 14 years since I graduated. And I just came to see Dr. Uzwak because it was just like he played such a huge role in my career so far. So I think you nailed it in like you get to have that smaller college experience and meet and get to know the professors. So I hope you, over the next little bit here, like you continue to foster those relationships, because you're going to keep those when you graduate.
Oh yes, 100%. It's amazing, honestly. And just soaking up the knowledge that they have to give and any of the life advice, because, you know, they've been there, they've done that, and we haven't yet, or I haven't yet. You have, Neki, but yeah, it's nice to be able to see that for sure.
Unreal. Well, cognizant of the time, don't want to keep you too long. We know you got some people to train, some books to hit. So we'll close it off there. Emily, it's been an absolute pleasure. Not only getting to hear what other dental students and what others are going through and have a little bit of trauma bonding, but actually get to know you personally. So it's been an absolute pleasure.
Yes, thank you guys so much for having me on.
I enjoyed our trauma bonding. I thought it was great.
You know, you unveiled some things for me, or unveiled rather, some things for me that I did not click before. So
lots to give the therapist to talk about. So.
Yeah, exactly.
Here we go.
Awesome.
Thank you so much for coming on, Emily.
Yeah, you have a good rest of your Sunday, you guys.
Yeah, you too.
Welcome to the Hi, I'm Neki. Is that a sweater?
Yeah, dude, it's the Hi, I'm Doctor sweater. Oh, dude, I see you got yours on too. Looking sharp, bro.
Dude, where'd you get yours from?
It was super easy, man. I just went on to our website, www.hiimdoctor.com. That's HIIMDR.com.
We have a website. We must be raking in cash from selling these sweaters.
Dude, we are killing it. I mean, if that includes losing money on every single sweater that we make, I think we're doing really well.
Yeah, Neki and I are donating all proceeds, which is zero, to charity because we are losing money.
I wonder if the charity will pay us. I think we got something here, man. Let's keep on keep on losing money on every sweater.
Alrighty, guys, go check us out. HiI'mDoctor.com.
We'll see ya. Akil, what'd you think of Emily? What do you think of all the trauma bonding we did?
It's just funny how much in common all of us have. And, you know, I think we touched on it after. It's like, you don't get to, this podcast is really cool because you get to go deep very quickly, and you get to kind of talk about these like macro kind of issues that you wouldn't normally talk about when you're just having a conversation with someone.
Yeah, absolutely. I honestly, I did not think the conversation was going to go there, but I'm glad it did, because I think a lot of us have those insecurities, and we've all had shit said to us as a kid, and it sticks with us and it always eats at us. And so it's cool to hear that, you know, we're not the only ones, right? And Emily has worked so hard. Like, you should see her Instagram. We didn't even plug her Instagram. I feel bad. It's at your fit M, YOURFITEM, and she shares so many workout tips, and you can tell how hard she works. So I think it's absolutely amazing, and I'm proud of her, and I barely know her, so I'm very, very proud that there's people in dentistry that are able to multitask like this and help people throughout school through their fitness journeys, and as well as with their patients.
You know, there's so few people that actually say that to you. Like, you have so many things going on. Like, I think people would come up to you and be like, hey, Neki, you're a great dentist. Do a lot of people come up to you and be like, hey, like, I love that you're doing all these things at the same time? And because everything takes a lot of time, right? Like, do you get that sort of recognition, or do you feel like
No,
you don't? You don't, eh?
No. I think people will come up to me and they'll say like, hey, I don't really get much of the, hey, you're a great dentist, because I share all my failures more than I share my success. So I get a lot of like, you know, hey, you're a great presenter. Hey, it was, you know, you were very engaging. I'll get compliments like that, but I don't think I've ever gotten a compliment, hey, you're a good multitasker. But I find that I do multitask a lot, and I think it comes at the expense of my social life for sure. But I have so much fun doing it though, man. Like, I don't know what else I would do if I didn't have, you know, all my eggs in a whole bunch of different baskets. So you gave me a lot to think about there too. Like, what am I compensating by doing that?
Yeah. Well, I mean, I think it's a bit of a tricky thing, right? Because I made a post about this just before we got on the pod, and, you know, I got some recognition this week for things we talked about
absolutely
in another pod. But it's like, it's funny because
Peak 2023 emerging leader,
as an entrepreneur, you don't really like, and basically any dentist who's a practice owner is an entrepreneur. No one's gonna come up to you and be like, hey, you're a really good entrepreneur, right? Like, your patients aren't going to say it to you. Your staff probably won't say it to you. No. And you're on your own little island, because you can't share your successes with your patients and staff because they might take it the wrong way.
Absolutely.
Right? It's like,
there's no doubt about that. Absolutely.
If you told a patient, hey, like, I'm expanding my practice to have 10 more ops, it's like, what, am I not a priority anymore? How much money are you making? I only see you for 5 minutes. Am I still going to see you? Who's going to be here? Who's going to look after me? It's like all these things come up, but none of those thoughts are, hey, that's amazing. Like, good for you. Like, you know, you deserved it. You worked, you know, hard to achieve that. So that's, you know, Emily, good for you. Good for you for doing that, because I think that doesn't get said enough. That doesn't get said enough.
Yeah, no, my girl, Emily, I'm proud of you, girl. Way to go. Keep up the great work.
Exactly. Well, hope you guys enjoyed this episode.
We'll see you next week.